You can kick us off, Luke.
All right, is Kim here?
I sure am.
Okay, all right. Good afternoon, everyone. Thanks for joining us today. My name is Luke Boemker with ARC Benefit Solutions, and you're going to hear from my colleague Kim here in a little bit, but this is kind of meant to be educational, informational, what employers need to know about Medicare. So move on to the next slide here, please. There we go. A couple housekeeping items. Everybody is on mute. If you do have any questions, there is a chat box, and we will try to address the questions as they arise. So in the GoToWebinar, I'm not sure what you call the little presentation box, there's a spot at the bottom for chat. If you open that up, you can ask any question that you might have, and we will do our best to address that throughout the course of the presentation. All right, next slide. So there's my picture and Kim's picture. I'm in our Cincinnati office. Kim is out of our Toledo office. And again, we appreciate your guys' time here today, and hopefully you'll find this session to be valuable and informative, and hopefully something you'll learn a little bit more about Medicare and how it works for your employees, and also really kind of what to expect and what you can and can't do from an employer standpoint as well. Just to, ARC Benefit Solutions does not handle 401k plans, but we do get asked about them from time to time. We have partnered with Newport Retirement Services. So this is something you were tossing around the idea with offering 401ks to your employees, or if you have a plan in place and you look at other options, please let your account manager know, and we can put you in touch with the folks at Newport to kind of help show you some options and see if it makes sense for your business and your employees. And also, we have a monthly e-newsletter that we try to send out that has helpful tips and tricks on, different legislative or compliance things that you would be beneficial for you to know and understand about, maybe health and wellness tips, industry updates, things like that. If you're not subscribed to it, there's the email address, news@arcbenefitsolutions.com, and we can make sure that we add you to the monthly newsletter. And if you don't want it, you can always unsubscribe from it too. But I think most of our clients find some of the information there is pretty beneficial for them. So I'd encourage you to take a look at it if you haven't been looking at those already. All right, next slide. All right, so Medicare basics. So I'm going to kind of handle just the 101, the basics of Medicare, the ins and outs, and then Kim's going to really kind of do a dive into how this impacts employer groups and what you can and can't do. So next slide, please. So Medicare is, government-run health insurance. It's been around for nearly 60 years, and it is predominantly for people that are turning age 65. That is when you become eligible. But you can also be eligible for Medicare if you have been on disability for the past 2 years. But for the most part, people turn 65, they're eligible for Medicare. And, some employees are continuing to work, longer, and so they may opt to stay on their employer plan. But there are two types of Medicare. There's Part A and Part B. I'm going to kind of go over those in a little bit. But what we see is, about half the population today, when they are turning 65, they are retiring and they want to come on a Medicare plan. However, the other half of the population is not retiring at age 65. They are continuing to work later in life, or maybe they're waiting to their full retirement age of Social Security is at 67 for the majority of the population now. So, everybody kind of has their different thoughts on what they want to do, or maybe the one spouse is turning 65, but the other spouse is 63. So they want to wait till, both of them are Medicare eligible. And so we're going to kind of go over just, what does Medicare look like? What are some expected costs? What are some options? And then what are my options as an employer as it relates to my employees when they do come of age and turn age 65. Next slide. So Medicare Part A, this is part of your, payroll tax that everybody gets to pay on a, biweekly basis or however your payroll is structured. But essentially, if you work 40 quarters, which equates to 10 years, once you turn 65 on Medicare, you don't have anything else to pay for Part A because you've been paying for it your entire life. Part A is also known as inpatient care, and this covers your hospitalizations, your skilled nursing facility visits, things like that. Original Medicare by itself is just Part A and Part B, and it contains deductibles and co-insurance that you're responsible for. Not a whole lot different than a group health plan. The downside to original Medicare is it does not cover medications. It does not have any stopgap, kind of a maximum out of pocket. So if you had some serious issues or problems, the costs that you may experience can be quite high. So the majority of the population, they have to have A and B if they want to look at other options, but very few people only have original Medicare anymore. They may have that to go coincide with their group health plan or some type of other Medicare coverage that we'll talk on in a little bit. Part B, you do have to pay for every month, and this amount adjusts index for inflation every year. The 2023 amount you see on the first bullet there, $170.10. If you have higher income levels, that amount can increase up to almost $500 and something a month if you're earning over like 750,000 jointly. So it's kind of a tax that the government puts on the high wage earners, as they call them. And if you have incomes under a certain threshold, you can also get your Part B premium for free, so you don't have to pay for it. But the majority of the population, they're paying $170.10 in 2023 for Part B. Part B covers outpatient services. These would be things like your doctors, your lab work, your therapy, emergency room, outpatient services, things like that. The way Part B works, you have a deductible to meet first, and then you pay 20% for all services that are not preventive. So your pap smears, your colonoscopies, your mammograms, those would be covered at 100%, no charge. But for your other routine doctor visits or checkups or visits with your cardiologist, whatever it might be, you have to pay the first $233 in the year. That's deductible. That also is indexed for inflation. You have to pay that once a year, and then once you hit that deductible, then you pay 20% for your services received. The last bullet is kind of what I alluded to a little bit ago, though, is a downside with original Medicare. There is no annual limit to what you pay for Part B. So if you have somebody that has some serious health conditions, or maybe they're undergoing chemotherapy or something like that, radiation, those can be quite costly, and they keep paying 20%, and it's almost an infinite amount. So there is no hard cap on just original Medicare. So that's why we see a lot of, employees and consumers in general, they want to look for other options outside of original Medicare. Next slide. So people look at kind of two different routes to go, and I'm going to touch on both of them. Option one would be a Medicare supplement. You may have heard that term before. And then that also pairs with a standalone prescription drug plan, or also known as Part D. And I'll touch on that in a little bit. And then you have a totally different option, which is a Medicare Advantage plan, which includes Part D built into it. They're kind of Medicare supplements and Advantage plans are kind of polar opposites of one another. They work differently. They have different coverage amounts and different pricing and network structures, and I'll do my best to kind of touch on those differences here. But the coverage is all based upon what works best for you as an individual. They are not family plans. Husband and wife are on separate plans. If they have grandkids that they're taking care of, that are living with them, the grandkids aren't covered by Medicare. So Medicare, pretty much, you have to be age 65 or older, and it is an individual buying decision. Next slide. So the first thing is Medicare supplement, also referred to as Medigap. A lot of people refer to it shortly as MedSup for short. So it works hand in hand with Original Medicare. Original Medicare is the primary coverage, and the supplement pays secondary. So it fills in the deductibles, the co-insurance, or the co-pays that Original Medicare has. So it picks up your Part A deductible, it picks up your Part A co-pays, it picks up your Part B deductible, it picks up your Part B co-insurance. It kind of has a stopgap, so you're not out tens of thousands of dollars in co-insurance if you had that chemotherapy or radiation or those really expensive injectable medications that you get in the doctor's office. So it really, helps to the consumers and the members control their costs with a monthly premium. And the supplements are offered by insurance companies. There's about 50 or 60 different insurance companies out there that offer Medicare supplements. If you look around to the commercials you see on TV, it's often some of the names you're probably very familiar with on the group side, like Anthem or United Healthcare or Humana or Aetna, Medical Mutual of Ohio, companies like that. They offer these MedSup policies too. The nice thing about MedSups is there's no network, so you can go to any doctor or hospital in the United States you want to go to as long as they accept Medicare reimbursement, which is a vast, vast, vast majority of the doctors. So if you're in Hamilton County in Ohio, or if you're in Cuyahoga County or Lucas County or Franklin County, really doesn't matter. You should be able to go to see just about any doctor, any hospital that is in that footprint. If you need to go receive care at, the Johns Hopkins or any other national renowned health systems across the country, or if you're a snowbird and you live part of the time in Florida, you can, they're portable. You can take that plan with you and use it while you're down in Florida, or if you're seeing the grandkids across the country. Supplement plans are standardized. So the coverage from one insurance company to the next is identical, and they have the different letters. So we have Parts A and Part B of Medicare. With Medicare supplements, we have plans. So we have plans A and B, not that common, but C, F, G, and N are the most common, where right now I would say Plan G and N are mainly the two that most people are going with. So a Plan G with Anthem is the exact same as a Plan G with United Healthcare, is the exact same with a Plan G with Medical Mutual of Ohio. The benefits are identical. The biggest difference is the name on your card, so who's your insurance company and your premium, so that can vary. And then, some of the companies offer extra benefits on their supplements. They maybe offer some vision discounts or gym memberships or a dental discount here and there. So lots of, every company does things a little bit different to help add those value added benefits in there. But for the most part, the plans are identical. And when they're receiving care, they show the original Medicare card and their supplement card for any, Part A or Part B covered services. And depending upon the plan, they may have little or nothing out of their pocket they have to pay. All right, next slide. Then you have kind of Medicare Part D. So this is D for drugs. So this includes prescription coverage. There are two ways to get Part D. One way is a standalone prescription drug plan, or PDP for short, that only covers medications, only covers the drugs. And so that would be used with Original Medicare or with Medicare in a supplement. Because those supplements that I just talked on the prior slide, they do not cover medications you get at a pharmacy. So that's where Part D comes into play. And the vast majority of the population has some type of Part D coverage. Maybe if they are a former military person, they could get coverage from the VA. So a lot of those people may not have a standalone Medicare Part D plan, or if you're still working, maybe they're getting their drug coverage through their employer plan or their spouse's plan, something like that. But for everybody else, they're getting their Part D plan one of two ways. So that's either staying alone or that bullet that there says embedded into a Medicare Advantage plan. So I'll talk on those plans in a second, but it would also be included in that MAPD or Medicare Advantage plan that has Part D. And the drug plans, they're similar in how they're structured because the plans vary by county, by pharmacy network, drug formulary, drug pricing, deductibles, premium. The insurance companies have to follow a certain set of guidelines for Part D plans, but for the most part, there are not any two plans that are identical. They may be similar from one carrier to the next, but the benefits are not exactly the same like they are on a med sup. They are not standardized. Okay, next slide. So then you also have the third wheel here, which is called Medicare Advantage or Part C. So this graphic here, if you do the government's math, Part C equals Part A, Original Medicare, plus Part B of Original Medicare, plus Part D, which is your standalone drug plan. So with the Medicare Advantage plan, you get your hospitalization coverage, your outpatient services and doctor coverage, and your medications all into one plan. You're still part of Medicare. You have to have Part A and Part B of Medicare to qualify for Part C. You're just receiving your Medicare benefits through the private insurance company versus the federal government. So again, you're receiving your plan through Anthem or Humana or Aetna or United Healthcare. Again, you see these commercials on TV quite a bit, or definitely in the fall. They're attracting the Medicare population with their Advantage plans. Medicare Advantage plans are very similar to commercial group coverage. So they have networks, HMOs and PPO networks. You got to use the network doctors or network hospitals, and their copay plans. So you pay as you go. You go to the doctor, you go to the hospital. Maybe you have a $10 copay for your family doctor or $40 copay to see your specialist, or you need to go to the ER, might be $125 copay for ER visit, or you need an X-ray, might be $100 copay for that. But most of the Advantage plans, the biggest difference between a group plan and Advantage plan is most of them do not have deductibles, so it's first dollar coverage. And the other nice thing is there's no medical questions. So, if they, depending upon their health, really doesn't matter. Anybody that wants a Medicare Advantage plan with Anthem that lives in Hamilton County, that's eligible for Medicare, they can jump on one of those plans. Right now, almost 50% of the population that is on Medicare is enrolled in a Medicare Advantage plan these days. They've been around for a little over 20 years now, and they have seen massive growth those past 20 years. They've been just gradually increasing up, almost like a staircase. They just kind of been going up. Membership's been increasing 2 to 5% a year every year the past 20 plus years, and so right now, over half of the population is enrolled in a Medicare Advantage plan today. The reasons for that is the benefits are very comprehensive, the benefits are strong, and the pricing is quite affordable for the majority of the population. There are a lot of plans that are zero premium, partly because they're funded by Medicare. Those tax dollars are given to the insurance company by Original Medicare. So it's big business for the insurance companies. The government is offloading having to be an insurance company and moving it to those insurance carriers to manage their care. And the consumers usually win too because they're getting better bang for their buck, better benefits at a lower price point. Next slide, please. So kind of some differences between the two. So on the left side are Medicare supplements, right side Medicare Advantage. Supplements typically have higher monthly premiums, where the Advantage plans typically are low premiums or no premium at all. Your supplement, it pretty much has a guaranteed rate increase every year, where the Advantage plans, they're not guaranteed to change. They're usually pretty steady. And if your plan was 0 last year, it was probably 0 the year before that, and it'll probably be 0 next year as well. So the insurance companies want to make those Advantage plans as the benefits as rich as possible. Supplements, after you pay your premium, though, you really have little or no copays or out-of-pocket expenses for your medical care. Whereas on the Advantage plans, you have copays. It's a pay-as-you-go. You may have higher out-of-pocket expenses. So if you have a lot of health conditions or seeing a lot of providers, the Advantage plans, may cost you more in the long run than a supplement might. Supplements, you go to any willing Medicare provider you want to. Advantage plans, you have to use a network doctors. You got to use a network providers. The med sups, they do not include drug coverage, so you have to pick up a standalone Part D drug plan, where the Advantage plans do include the drug coverage in them. The supplements, the benefits never change as long as they're on the plan. Where the Advantage plans, those benefits can change annually, and they do change annually. The supplements, unless you have guarantee issue provision, you may have to qualify medically to purchase a supplement. Or the Advantage plans, there's no health questions. There's no pre-existing conditions. Doesn't matter what you have. If you're eligible for the plan, you can pick it. And eligibility is usually got to live in the service area. You have to have A and B of Medicare. Next slide. And just kind of a quick chart to show you expected costs. So trying to compare in the middle there, Medicare supplement and Part D, and on the right is Medicare Advantage that includes Part D. So Medicare Part A, you see both categories, there's no premium. So this assumes this person's worked at least 40 quarters in the US, has already paid taxes for Part A. They have nothing else to pay. Part B, I told you pretty much everybody has to pay $170.10 a month. This comes automatically out of the Social Security check every month. If they're not on Social Security, it's billed to them quarterly. Everyone's, for the most part, paying that amount. So it doesn't matter if you go the supplement route or the Advantage route, you have to pay the Part B premium. Where the difference gets into is what the supplement or the Advantage plan pricing is. So the supplement premium, monthly premium, this should say pricing or monthly premium, is anywhere from $120 to $200 or more per month per person. So somebody turning age 65 that wants to enroll in Plan G, probably around $130 a month, give or take, maybe $120, depends on the insurance company and where they live. But if somebody's enrolling into Medicare for the first time, obviously the pricing is going to be lower on a supplement than if they're 72. Their pricing is going to be a little higher. Medicare Advantage plans, though, the price does not matter based upon your age or your health status, and the good majority of the population are on plans that have 0 premium. They do have plans that have higher premiums, and all the higher premium does is you have lower out-of-pocket costs, so it keeps your costs down, and your copays and co-insurance are much lower. With the supplements, you do have to get a standalone Part D plan. So you're going to have to, depending on which plan you choose, there's a huge range in pricing there. But those prices, vary, again, the types of medications they're covering or what the outpatient costs are, roughly $7 to $100 per person per month. Where with Part D or with the Medicare Advantage plans that include Part D, there's nothing else you have to pay. That's included in your premium. So when you add everything up, your supplement plan with your Part B and your Part D could average just under $300 to $470 per person. Whereas a Medicare Advantage plan, you're looking at about $170 starting out at the low end to maybe $300 at the high end. So again, it's kind of just depends on, with the supplements, you're kind of prepaying for your health care up front, or the Advantage plans, you're paying as you go. All right, so hopefully that was a quick high-level overview, really a Medicare 101. the differences between original Medicare, a supplement, Part D, Medicare Advantage. If you have any questions, please let me know. Feel free to put it in the chat box there. But I'm going to kind of turn it over to Kim, and she's going to kind of go more into really what you know as an employer and how Medicare, impacts you and your employees and what you can and can't do. So Kim, take it away.
Thank you. We did get one question while you were talking. That was Karen asked if they can have access to the PowerPoint afterwards. We're happy to share that. We also have a flyer that we've developed for employers to give to employees about, that just kind of talks through some of these things we're getting ready to cover with you guys. So just so you know a little bit about me, I've got over 20 years experience on the employee benefits side. Luke is really, he's good at everything, but he manages a team of our client services unit with specialists who understand individual and senior products. So the combination of our teams is designed to help support you and your employees as you go through this process. So just know that you have a lot of people at ARC Benefits who can help your employees through this process. So one of the main questions I get just about every year is employers want to know, can I just pay for my employees' Medicare premiums? So what do you think the answer to that is? You can just put it in the chat box or in the questions. I'd love to hear what most people say. I was going to make this a poll question, but curious if anybody wants to hazard a guess on that. I'll give you a second. It's not a trick question. Okay, nobody, okay. I don't think anybody wants to answer that question. All right, the answer is no, you can't just pay for the employee. There's a couple of exceptions to that, and I'll go into that. Oddly enough, it's considered discrimination because it creates an incentive for the Medicare-eligible person to take Medicare instead of the employer's plan. And so the government doesn't want you to do that because it costs them more money, I think. So why not? First rule is that Medicare secondary payer rules have some employer requirements. One is that group health plans must provide a current employee, an active employee, and their spouse and dependents with the same benefits under the same conditions that it provides to employees who are under age 65. It's also considered age discrimination. You cannot offer any financial or other benefits as incentives not to enroll to a Medicare eligible person. And you can't take into account the fact that they're entitled to Medicare as an individual. So what does that mean to take into account Medicare entitlement? So it means refusing to enroll or terminating coverage because the person's eligible for Medicare, imposing benefit limits for Medicare entitled people that don't apply to others, such as excluding benefits or charging higher deductibles, charging them higher premiums, requiring longer waiting periods for coverage to start, or offering any financial or other incentive to encourage enrollment in Medicare. Now, there is a caveat to this. If you offer the incentive to all employees, we call it cash in lieu of benefits, you can provide an incentive for all employees who take other coverage, whether they enroll in their spouses or they enroll in individual, but you have to make that same incentive available to everyone regardless of their age. Okay. If you want more information on that, just let your client advisor know. They can get with me, or you can just call me. You saw my number on there. The other additional why nots for why can't I pay for my employees' premium, the ACA, Boemker, has a prohibition on reimbursing employee premiums. And that goes for individual premiums as well as Medicare premiums. However, you can reimburse employee premiums if you establish, I call it the QSEHRA, the QSEHRA, Qualified Small Employer Health Reimbursement Arrangement. It's just for small employers under 50 employees. It has dollar limits on how much you can contribute, and you can allow people to buy individual or Medicare products with a QSEHRA. The other option is becoming more popular is the ICHRA. That's individual coverage HRA. And that's permitted for all employers with no limits, which sounds great. Why don't I just do an ICHRA or a QSERA? Problem is neither one of those can coexist with group health coverage. So if you offer health insurance through Anthem, a group plan there, you can't offer an ICHRA as well. Number one, the carrier has restrictions on that, and then so does the government. So they're just basically kind of steering you one way or the other. So what can you do? And I put the cost of Part B. I must have gone to an older site. Luke had the correct number, the 17010, so I'll correct that before that goes out. But the cost of Part B was roughly 164.30 or 170.10, and it adjusts based on your income. Cost of Part D is approximately $43 a month, but I got that from the same site, so again, my numbers might be off. So when you think about how much you're charging for employee benefits, that's why I say you want to review your contributions, because if your contributions are less than that, if you're paying 100% of the employee cost, or you're paying, 75% of employee plus spouse, and they've got a spouse who's also age 65, and they've got to pay this for two people, your plan is probably cheaper for them, right? It'll really come down to benefits. How much are they using the benefits? They kind of have to do some math. You can have a conversation with the employee about what makes sense for them. Again, you don't want to incentivize them to go one way or the other, but it's okay to talk to them. Hey, would you like to talk to somebody at ARC about whether a Medicare plan will work better for you guys than being on our group plan? And, it doesn't make a difference to you. And I will say, a lot of people say, well, is it going to save me money if this person comes off the plan? If they're healthy and you're on a medically underwritten plan, like a level funded, or you're with one of the MEWAs, those are medically underwritten. If they're a healthy individual or their spouse is healthy, they're probably not impacting your cost all that much. They're actually helping you. But if they do have a lot of health issues, it might help your health insurance premiums go down. If you're buying ACA plans, it definitely will help, just because you're going to save that premium dollar, and it's age banded. And there's no cutback if the person buys Part B. So there are some incentives with some of the medically underwritten options where you get a different price if you have Medicare in place. And we'll talk about that in a little bit. In the end, what you want to do is make sure that you allow the employee to make the choice that's right for them. Okay. Oops, I just zipped through a bunch of, I hit my button. I'm going the wrong way. Excuse me. I'm so sorry. Okay. So what are some reasons employees don't enroll in Medicare products? We talked about cost being one of them. Sometimes they'll have a younger spouse, or they still have dependents at home that still need coverage. I call it the young hot wife or young hot husband. And, but I've learned not to do that anymore, because one of the businesses I was meeting with, he said, well, I would have kept the old wife, but she passed away on me. And then I felt about, yay high. But he laughed about it. I laugh and tease about it. In some cases, they believe their employer's plan is better, and a lot of times that's due to prescription drugs. The third reason is they don't want to mess with it. As you heard from Luke, it can be daunting. When this all becomes available to you, you're being bombarded by these ads on TV and in your mailbox. People are calling maybe. I mean, a lot of people just say, I'm going to keep working, so I just don't want to mess with it. They don't know where to start, or they're anxious about that change. And again, we've got folks that are very well versed in Medicare products that can help guide your employees or their spouses on what to do and what makes sense for them. And look at, what prescriptions are you filling and what doctors do you need in your network to see if some of those Medicare Advantage plans, the no premium deals, will work. Sometimes they'll enroll both your plan and Medicare, thinking that more insurance is better coverage. In some cases that works, in some cases it doesn't. It's a good idea to have the employee look at that, and don't just look at it once and leave it. You want to look at it every year, in my opinion. In some cases, they're not ready to retire. As Luke mentioned, Social Security starts at age 67 for most working adults. For me, it doesn't kick in until I'm in my 70s. It's really depressing, but So they're going to continue to work because, they know that their Social Security is still there, and they've got access to coverage through you. And then, of course, the cost of coverage is the number one reason why they just say, you know what, my employer's paying a much higher percentage of the healthcare costs and very little comes out of my paycheck. I'm going to keep this. Okay, so I think one of the taglines we said is there's 6 reasons why, or 6 things to know. This is one of them. Part D notices. What's the point? First of all, they tell the employee whether their coverage is better than Part D or not. And that's what that creditable and non-creditable means. They're also proof to CMS Medicare if the employee enrolls in Part D later than age 65 that they had creditable coverage, because they want you to have proof that you were covered by creditable coverage from the time you turn 65 till whatever time you retire. So I recently helped an 88-year-old person who decided to retire finally after that long of working. We went through and found all the employers' SBCs and benefit summaries that proved that he and his wife had credible coverage that entire time. And what happens is if the coverage isn't credible, they'll get charged an additional fee. And I did the math here in 2023, it's 1% of 32.74 times the number of months that they didn't have Part D or credible coverage in place. Okay. Good luck figuring that out. No wonder people stay on their employer's plan. It's a lot easier. Your group size actually matters. So this is 2 and 3. 2 and 3 things you need to know. Again, it goes back to those Medicare secondary payer rules. Those are the kind of rules of the road between insurance companies and Medicare, and they kind of tell the insurance companies when it's Medicare's responsibility to pay the claim and when it's the insurance company. So if you have 20 employees, and this is counting all employees, even your part-timers. And so sometimes people don't always factor that in. And we've got like a little checklist for our client advisors that when they're looking at a renewal, they're supposed to check in with you and go, are you still over or under 20 employees? Because you can go under or over 20 employees within a year. If you're close, that can happen, and it can affect who pays first, who's on first. So if you're over 20, your plan pays before Medicare kicks in. And that's, for small businesses under 20, that's kind of a nice thing that they do for small business. But for people who are on your plan, they need to watch out for HSA contributions 6 months prior to age 65. For over 20, you don't need to worry so much about whether you have Part A and Part B. You're going to get Part A automatically, but Part B, they don't necessarily have to have that in place in order for the benefits to work correctly. When you go under 20 employees, your plan pays after Medicare. Now, your insurance company doesn't automatically know when you're over or under Medicare. So it's a good idea to kind of take a look at that every time you renew. If you're close to that, or if you're definitely over, fine. But if you might be under and you were over the prior year, it's worth a discussion with your client advisor, because you have to fill out paperwork. And Anthem, they love forms. They got a form you can fill out when you confirm that you have less than 20 or over 20 so that they pay your claims correctly. So in the under 20 market, you have to watch out. Individuals have to be careful, because many of the carriers require that the member sign up for Part A and B, and they will pay claims accordingly. Now, some of them are nicer about it. They will offer a reduction if the person buys Medicare Part B, but you have to fill out some paperwork proving that you've purchased it. They file something with CMS so that the claim coordination, the claims flow goes through CMS first and then comes to the carrier, showing what was paid by Medicare. And so it can be messy if you change insurers, or if you wait till after you've had some claims and they're paid incorrectly. Sometimes CMS will start denying claims because they think your plan might be primary. So it's really important that if there is a change in carrier or at the new once you turn 65 that you do that paperwork that's necessary. There is no rate change available for ACA plans, and those are the fully insured. That's a plan where the rates are the rates. They don't do any cutbacks. Everybody's rated the same. Everybody has the same rates based on their age. So just keep that in the back of your mind. And by the way, the under 20 rule where Medicare pays before your plan doesn't apply to members if the reason for their Medicare eligibility is due to disability and they're under age 65. So for example, if you have a spouse on the plan and they're 36 and they're on Medicare, your plan will still pay primary on that person. Okay, clear as mud, right? Another tactic that people use, this is number 4 on the list, COBRA and Medicare. A lot of people, when they start to move into retirement, they might put their spouse on COBRA. You know, they go ahead and retire, put spouse on COBRA, and then, you know, allow that person when they do turn 65 to go on to Medicare. However, being covered by a group COBRA plan is not considered creditable coverage for late enrollment into Medicare. So you have to get off of COBRA as soon as you turn 65. So for example, if you meet your out-of-pocket max, you may not want to move right away into a Medicare product, but that can bite you in the, you know, come back and bite you at some point because it's not counted as credible coverage. It's ridiculous because group coverage, employer-based coverage is, but COBRA is not, even though it is group coverage. We have been trying to fight this. We're part of an organization called the National Association of Health Insurance Professionals, NABIP, used to be called NAHU. We've brought this up with countless times with legislators, and it just happens to get fed into bills that don't get passed. And unfortunately, I think a lot of people are aware of it, but it's a ridiculous thing. But basically what would happen is if you stayed on your COBRA coverage and then enrolled after you turn 65, you could be considered a late enrollee and pay higher premiums. Not many people are going to get caught by that, but it does happen on occasion. The other thing that happens, this is number, I think it's number 6. Yeah, it's number 6 on the list. HSAs in Medicare. So a lot of groups put in a health savings account or high deductible health plan that's compatible for an HSA. And so people that are getting ready to turn 65 have to be very careful because Medicare entitlement can disqualify employees or their spouses from making HSA contributions. And that qualifying period begins 6 months prior to turning 65. And it also impacts the spouse's ability to contribute up to the family limit. So for example, husband and wife, employee turns 65, the spouse cannot contribute up to the family limit, even though they have a family limit deductible, because Part A is automatic if they're getting Social Security. You can opt out of Part A and B if you're actively employed in order to continue contributing to an HSA, but most people don't bother with it. They just, you know, ratchet it down to the single contribution if they have a spouse under age 65, or they just, you know, buy a plan that's not an HSA. But it's, if you only offer an HSA, that's something to think about and consider, and maybe think about offering a PPO plan or 2 plans if you're big enough. Some carriers don't allow you to offer 2 plans if you're very small. The one thing is, whatever you've got in your HSA, the employee can still continue to use what's in there to pay Medicare product premiums or for qualified expenses. And so those are the top hot buttons and things to think about. The other thing I mentioned, I think I can share this. Let me see if you guys can see it. Yeah, so this is a document we put together that can be shared. And I think, you know, it's nice to give to people that are nearing 65, or, you know, if they're 64 and you know they're going to turn 65, you might include this or give this to your employees at open enrollment so that they can make an informed decision or start thinking about this. But it goes over pretty much what Luke and I talked about today. What is Medicare? Who's eligible? Here's the Part A, B, D supplements and Part C. And, we've got our phone number on here so employees can call us and we can talk through all of that. And then those 6 things that I talked about at a high level, they're mentioned here. And just some things for them to think through, because every situation is slightly different. There's no one size fits all on this. It really does depend on what the circumstances are for each person. So we know that this can be confusing, and we're here to help the individual member, especially when you're changing carriers and you have people who are getting care and know that they have Medicare in addition to the employer plan. We want to make sure that who's on first is set up. There's paperwork that has to be filled out. So we like to be proactive so we don't end up with some claim issues on the back end. It takes time out of everybody's day doing, we call it stupid stuff. It's not stupid, but you know what I mean. It's like a problem that you wish you could avoid if we just talk to one another. But we're here to help, like I said, and I'm curious if anybody has any questions or follow-up items that I can address. I don't know if nobody's raised their hand. If you do have any other questions, like I said, we'll share this document with everyone who attended. And I don't think we shouldn't have a problem sharing the PowerPoint either. But if you do have questions, contact your client advisor. You can contact me, or you can contact Luke, and we'll be happy to get an answer to you. And again, like I said, we've got people here that can answer questions from any and all employees. If they want to sit down and look at what's specific to them, we'll walk them through that. With that, I'm going to close everything down. Thank you so much for attending. We really appreciate your business. We hope this was helpful to you. Oh, wait, Karen has a question. Nope, same question about the PowerPoint. Have a great day. Thank you again. Talk to you soon.
Thanks,
Bye-bye.
everybody.